And now it gives me great pleasure to introduce our 2022 CHHS Top Dog, David Pomaville. As I mentioned earlier, David is a proud alumnus of our public health program. This is my home department too, so I feel a little special, have special feelings about this evening, where in 1986, he earned his bachelor's degree in health science with an emphasis in environmental health. He is currently the Director of Environmental Health and Safety for Caglia Environment. Prior to that role, he served the Fresno County Department of Public Health for 30 years, eventually working his way up to become director in 2011. Most notably, he led the county through the early stages of COVID-19 pandemic with compassion and strength. His journey in the field is simply remarkable, and you'll be able to hear more about that in the next hour, so stay tuned. Let's give David a warm welcome in the chat. Give a shout out, welcome him, and let us know who's with us tonight. Moderating tonight's conversation are public health students Dawn Hagopian and Lupe Manzano. Both were nominees of the Distinguished Dean's Medalist Award for the College of Health and Human Services. This award recognizes their academic excellence, fantastic leadership, and passion for the public health profession. Dawn will earn her bachelor's degree next month with an option in community health. An interesting fact about Dawn is that while obtaining her bachelor's degree, she also pursued her associate's degree in nursing and biology from Fresno City College, earning many academic awards along the way. She hopes to combine these two passions and serve the Valley as a public health nurse. Lupe Manzano will earn her master's degree next month and hopes to play a vital role in improving the quality of life for underserved and underrepresented populations, particularly within the Latinx community. Growing up, she witnessed firsthand the cultural and linguistic barriers these populations face, which inspired her future career in public health. Dawn, take it away.
Well, David, it is such an honor to have this opportunity to interview you. And on behalf of both Lupe and myself, we congratulate you on the Top Dog Award.
Thank you so much. And congratulations to you too on graduating with both degrees. That's so exciting.
Well, thank you. I appreciate that. Talk to us a little bit about your career with the Department of Public Health. It's such a large agency overseeing hundreds of programs. What are you most proud of during your time there?
So it's hard to narrow it down to one thing. I was really proud of the way that that the department worked together in a couple of areas that I wanted to mention. One of them is we significantly improved the lead poisoning prevention program, where we were not only doing more tracking and early detection of lead poisoning in children, but we also implemented a mitigation program that actually went out into the community and mitigated the sources of lead, which were primarily lead-based paint that was used on the outside of homes and on window sills and so forth. And so we were really able to do some really great work in preventing lead poisoning in our community. I also was, I'm very proud of the work that we did in the early days of the implementation of the Affordable Care Act. And if you're involved in healthcare at all, the relationship that the county had with community medical centers and the delivery of services to the indigent individuals in our community was a very complex problem that we faced with the implementation of the Affordable Care Act. We were essentially losing funding, and I was very proud to be able to work with our community to come up with creative solutions to make sure that we didn't have people in our community that were previously providing services that they were going to lose services with the implementation. So that was some really, I think, important work that was done, and was very important to me that it was done as completely and correctly as possible. I'm really proud of the work that we did in emergency medical services, where we were able to, even with COVID, build a new emergency dispatch center that dispatches emergency medical providers for 17 different agencies, both fire and medical, in our community. It's a project that was Very difficult to move forward, but we were able to do it, and it's going to serve our community for the next 20 or 30 years. Today, I think the county commissioned the new animal shelter. That's a project that I worked on for about 7 years. It normally doesn't take 7 years to build an animal shelter, but we had no funding and no resources, and we really needed to build a program. What was interesting about the animal control program is there's a lot of parallels to public health in early intervention to solve problems. And we've worked with a provider, Fresno Humane Animal Services, that has done incredible work. Prior to them coming on board, the outcome of animals coming into the shelter was very poor. And now it's very optimistic, where they're able to do an incredible job of rehoming animals as well as getting them adopted and so forth. The response to COVID, I'm very proud of the work that we did there in terms of being able to leverage the assets in our community to work together and really leveraging the work that we had done prior in public health to make sure that the response was as complete as possible. And I can't leave out the work we did during the Creek Fire. That was a devastating fire that had significant implications to our county. The Public Health Department in Fresno is also the county's Office of Emergency Services. So we did a lot of that advanced planning, not only to prevent fires from occurring, but when they do occur, making sure that we get people out safely and that the impacts are mitigated as best we can. But if I had to go down to one single thing of what I'm most proud of, it's probably the people that I worked with. And in particular, there are 4 people that worked for me who are now department directors in other counties and are very successful. Sarah Boss in Madera County was part of my team at Public Health. She's now the director in Madera. Deborah Martinez, who worked in our California Children's Services program, was a very effective manager. She's now the director of social services in Madera County. Rosemary Rand, who spearheaded a lot of our vaccination programs in Fresno County and did the preterm birth initiative and so forth, is now the director in Kings County. And David Lucchini, who I worked very closely with at Fresno County, is now the director in Fresno County. So I think that's probably the one thing I'm most proud of, is the people I worked with, and to see them grow and advance has been very rewarding.
That's wonderful. And congratulations to all of them for their advancements here and continuing their careers. You've mentioned the response to COVID as being something you were very proud of. And there's certainly no escaping the impact of the pandemic that has had on all of us these past 3 years. Talk to us a little bit about what was that time like at the department? How did you handle it? How did it challenge you as a leader? And what did you take from that experience personally?
So I think in the early days, the very early part, we knew what to do. We knew how we needed to prepare the community for a public health emergency. We knew, we had been trained. We knew the steps we had to take. What I think challenged us the most early on was the inability to get people tested. And it's when you're investigating an illness outbreak at a nursing home, and you can't get reliable answers back for the physicians that are trying to implement control measures and trying to treat patients, it's very frustrating. Very early on in the pandemic, without having the ability to do laboratory testing was very difficult. We actually advanced, I think, remarkably fast with the mRNA tests, the PCR tests being developed, and CDC rolling that out. But one of the challenges we faced in Fresno County was our laboratory had been destroyed by a flood, a massive water leak that had occurred and destroyed the lab about a year prior to the pandemic. And so we were relying on a partner in Tulare County and some other counties to do that testing for us. It was hard because it just introduced more variables, and our physicians really early on in the pandemic wanted to be able to do testing ourselves. Thankfully, we had actually ordered some of the equipment that we were going to use when the new lab was rebuilt. And so it was kind of waiting for us, and we made a decision to go ahead and have it shipped to us so that we would at least have the equipment available. And we had kept our staff, which was important because you need people to run the equipment. The one thing I didn't have was a place. I didn't have a location where I could actually set up a lab. And it was one call to Fresno State to say, can we use some of your lab space to set up a laboratory? And the answer was overwhelmingly yes. They were very cooperative and helpful in making sure that we had a space available. And I think by April or so of 2020, we had the lab up and running and we're doing testing. And it wasn't so much that it was a high volume, high throughput, but it was a significant moral victory for us that we could now do our own testing. And when our physicians really needed to have precise information, particularly with regard to nursing homes, we were able to use that lab for that purpose. Obviously, testing became far more available over the upcoming months, but that was a big step. In terms of those early months, it was, at times it was, exciting and invigorating. It was very challenging. We had, a great team that we worked with at Public Health, and we really relied on the strengths in our community, the relationships that we had built. So we quickly aligned ourselves with different areas of focus that we knew were going to be challenged. And so we reached out to our schools and made sure that we had a really good schools working group that was set up that met every week. We met with our hospital systems regularly to work through, surge issues and really the beginning of the pandemic, it was all about supplies. We couldn't get enough masks for our practitioners to be able to wear them when they're treating patients. And that was a big problem for several months. In fact, some hospitals were to the point where they were having to reuse masks for multiple days. They were washing the masks. And it wasn't until later into 2020 that they became more readily available. That was a big challenge. It took a lot of communication and coordination. It took breaking out some of the caches that had been set. People were, holding on to resources because they knew they were in short supply, but it became sharing across that system so that we would all work together and move forward. We also had, a big challenge with our emergency services providers. Law enforcement didn't get to go home and work from home. They had to be out on the streets, and our paramedics had to continue to run calls, and our firefighters continued to have to staff the programs and so forth. And so we focused on them and made sure that they had all of the resources that we could get to them to make sure they had all of the knowledge and education that was needed for them to make good decisions. In fact, we had assigned a fourth-year resident at the time, Dr. Suki Dillon, who was supposed to, I think, go to India and finish her formal training in India. And of course, that got canceled. And so she came to work for us, and we assigned her to work with all those emergency response agencies between law, fire, and EMS. There's probably about 60 different agencies in Fresno County, and coordinate those early days of illness investigations and exposure control and all of that. Those were big challenges. As time went on, we got fatigued. It was very frustrating trying to address all of the data issues and the gaps in data. It was very hard to deal with that. We were, supplying a lot of information to the state, and not having it back at our fingertips for several months into the pandemic was very frustrating. We had to be patient with one another as we went through that. One of the things that was really rewarding was by the time we started to roll out the vaccine program, and our team had been at it for the better part of a year. So they spent all of 2020 without a vaccine. It was at the end of 2020 that the vaccine first became available. And we started to deploy it at the nursing homes and at medical providers and so forth. One of the best things that happened was we set up a distribution site at a couple of different locations. And one of the ones was at the fairgrounds. And so I remember the day that the governor announced, unbeknownst to us, that 75-year-olds are now eligible. And so they all showed up. Right? I mean, everybody over 75 showed up at the fairgrounds, and there were lines for days, right? And so we're trying to manage them. We're trying to get them back for appointments. We didn't have nearly enough vaccine to cover them. So we're trying to make appointments and do all of that. They could not have been more cooperative and patient and thankful. it was so uplifting to work with our seniors during that time. And over that next week, I encouraged all of my staff that had been working so hard to go out and spend some time talking to these remarkable people, and how thankful and grateful that they were to be able to go through that. Of course, into the next months, distribution of vaccines was a big problem. A lot of pressure on local departments to manage the vaccine correctly, and the temperatures that it had to be, making sure that the protocols were followed so that you weren't wasting vaccines. That was a big challenge in and of itself. Again, I think we at the public health department were pretty well working well together, so we were able to overcome some of those challenges. And again, the vaccine program really represented some light at the end of the tunnel, and so people were really, I think, re-energized and excited to work on that project. So it was challenging at times. Many of our staff worked from home, but there were many of them that reported to the office every day. Myself and my leadership team, we were there every day, many weeks, 7 days a week. We were on calls, it seemed like endlessly. And, we tried to do everything we could to be as responsive to the community as we could be. And I think, I know I'm going a lot on COVID, but one of the things that we were really insistent upon, and we as a leadership team we had to do, was to make sure that the frontline workers got addressed and we paid attention to them. But also it was our ag community. When I say ag community, I'm talking about the food processing industry. They showed up to work every day as well. And they made sure that there was food on our plates and made sure that the grocery stores had resources available to them. So it was very important to me that they were prioritized. It was important to the Board of Supervisors that they were prioritized in getting vaccine distribution programs going. So in February and early March, we didn't have vaccine available, but we started with work groups and talking to our farmers and talking to our labor folks and so forth, and said, be ready, get organized, start to talk to your people about the vaccine. As soon as we have it, we're coming. We're gonna get that deployed with you. So that was a part of what we did with regard to the response. There was a lot of times when it felt really overly political. There was a lot of times when there were sharp comments made in the media, and we tried not to listen too much to that. We tried to just pay attention to what our job was and communicate with one another and to be as responsive as we could be to the community.
I think the pandemic showed us how unprepared as a society we were to address a crisis of that type. How can we be better equipped to handle the next pandemic or the next public health crisis? Where are we strong and where do we still need to improve?
So you're absolutely correct. And I think what's different about this disaster from others is oftentimes other disasters are regionally focused. So you can pull resources from other parts of the country and you can deploy people and professionals to be able to address problems. We were many times at high need for resources that were just not available to us. But there were some things that early in the pandemic didn't go so well, but as we went through it, it made much more sense. So I'll give you one example. Some public health departments viewed their responsibility was they had to administer and control all the vaccines. I was not of that thinking. I believed we needed every one of our primary care providers providing vaccinations. We needed all of our pharmacies providing vaccinations. We really needed to build competencies with them to be able to do that. And I'm really glad that the state went that direction and did some big contracts with medical providers, Walgreens and CVS and so forth, to alleviate some of that, the allowing people to go. There's a lot more front doors of CVS than there are of the local public health department. I think we learned from that. The other part is, making sure the insurance companies, so it all boils down to who's paying for it, right? If the state wants to offer a free test, they want that insurance company to be part of that equation. So that means you've got to gather a lot of information about people before they show up. And that was something I think we can do much better at in terms of vaccine distribution. What was frightfully an error in our planning and preparation, just amongst friends here, was our pandemic response models were built on a single vaccine dose. So we were not prepared for 2 doses. So we get 1 dose in your arm, and then you're going out the door, right? Oh, wait a minute, you got to be back in 30 days. What are we doing about that? So the software that we and many other counties were using anticipated 1 dose because it was built on a anthrax model. So that's something that we definitely learned. One of the things that I did during the pandemic was about, I want to say it was about August of 2020. I hired a firm to come in and do a post-incident analysis. And I told them, I said, we're not even done. We're not even close to being done. But I want you to start interviewing my team about what went right, what went wrong, where we had strengths, where we had weaknesses. And by the time I left, it was still a draft report. And I'll tell you why it was a draft report, because I wanted it to be as open and honest a discussion and tool we could use. And I did not want it to be out in the public until it was ready, truly ready for prime time. And in the middle of a pandemic is not that time. But we documented a lot. We did a mid-pandemic report. And then I know that the department has done a second look at that. They've gone back about a year later and documented all that again. So that's really going to help us to be much stronger in the future as a local health department. The other thing that it was kind of interesting was the fighting for who has what control. And, I'll be real honest with you, when the state, we can all be mad at the state because they made a requirement that we didn't like, but they made the decision. And it was a lot easier to say the state made that decision and we need to implement it than it was, this was Fresno County's decision, because as soon as Fresno County moves an inch different than Kings, Tulare, Kern, the political ramifications of that are very difficult to manage. So we really had to work together as a region. As much as we didn't like some of the mandates that may have come down, we did the best that we could implement them. But the state having to implement that and play the heavy in a lot of this, the state health department, it made our life a little bit easier because there wasn't as much criticism. There are a lot of elected officials that say, hey, we want local control. And I think that that's good, but be aware, our hospital and healthcare system is not local to Fresno County. It's regional. Our providers it's really a Fresno, Madera, Kings, Tulare healthcare system. So you've really got to have a cohesive, work group across that system if you're going to be at all effective in implementing things. And we stayed together as counties very tight. We had a lot of communication between the Central Valley counties and sharing resources and so forth. That was very important to me, that we not lose track of what was happening with our adjacent counties, because you have Mariposa that has very little, ambulatory care. They have very restricted resources in some areas, but they were able to help us in other areas. So
I think you bring up a great point there about it being really a Central Valley healthcare type situation. It's not just Tulare County or Fresno County. I think you have a fabulous point there, how it is a true valley-wide effort to provide healthcare to this group of people. So as a public, what do we need to know about public health as a valley?
I think maybe one of the things is really to do a double check on where you're getting your information from. And I feel like, I almost feel it's kind of entertaining to watch the news sometimes just for entertainment purposes, but not to use that as a reliable source for information. I think that the public, and I was a little bit surprised at maybe how uneducated we were about disease and how it's transmitted and how we are biological living beings, and not the disease is not going to be the same in every person, and that there's a lot of reasons. I can remember trying to explain how PCR testing worked and why you may be positive but not contagious, and just the public thinking, well, that's just not a good answer. You're hiding something from me because you can't give me a straight answer. Well, these are biological living things, and we have to remember that. So I think our public can be better prepared from a public health perspective by being better educated in fundamental science and how it works and so forth, and being, looking for reliable sources of information as opposed to, some of our opinion pieces and that type of thing. But I think the other piece that the public doesn't understand is public health ends up doing a lot of what nobody else can do. So if you're talking about particularly trying to address populations that are vulnerable at risk, homeless populations, incarcerated or post-incarcerated populations, there's not big advocacies out there that from a health perspective that are solving all their problems. So oftentimes public health has to be that safety net provider for those individuals, and that's part of what the role of public health is to make sure that the people who are underserved or not served have access to care.
That's wonderful to hear. You've touched on the value of education and how important that is. And so that reflects back to Fresno State and how important those science classes truly are. They come in handy in a crisis like this.
Absolutely.
So at this time, I'm going to pass the interview and the questions off to my partner tonight, Lupe, and I'll let her pick your brain a little bit on some your experiences here at Fresno State.
Great. Thank you, Dawn. I really appreciate it.
Thank you.
Thank you so much, Dawn. So David, you shared about your career and accomplishments with the Department of Public Health and the impact of the COVID-19 pandemic. So now let's talk about your time as a student at Fresno State. So how do you think your time as a student at Fresno State shaped your professional career, and what is your favorite memory?
Well, I think, I don't know if I was unique or not, but I feel like Fresno State really prepared me to enter the workforce as an environmental health professional. And it was not only the classroom training, but it was the experiences that I gained with internships and working with local health departments and being able to have some level of interaction with them before I even started interviewing for jobs. And that gave me a real leg up to be able to have had interaction with the departments through internships and so forth. And, I think that I didn't know what I wanted to do when I came into Fresno State when I started, and I was kind of bouncing around a lot, but I kind of focused on the science, biological sciences, and then found my way to environmental health. And I think that Fresno State prepared me well. I stayed in contact with my professors, following that, and that was always very rewarding to be able to reach back and then have hired many grads that have been very successful. So I'm very proud of the time at Fresno State, as well as the graduation, the students that we've hired. Two favorite memories. One was, as a student, I was able to participate on Dr. Tennant's interview panel. So he was interviewing for a position at Fresno State, and I was actually one of the students that was selected to be on the panel. And so we spent the better part of a day with him and another candidate, and they ended up hiring Dr. Tennant. So we've maintained a great relationship for many years following that. And then my other favorite memory was with the Health Science Club at the time. I was a member of the board of the Health Science Club. I can't remember what position it was, but we would have events and nobody would show up, and we'd have more events, nobody would show up. And so it was very frustrating. So we decided, we had like $200 in the treasury. We decided we were going to close the club down. We were going to have a big party, and we were going to close the club down because nobody was showing up. And so we said, I think it was Shakey's Pizza, if I'm not mistaken. It was across the street from Fresno State. And so we were going to blow the whole $200 we had on all the pizza and beer you could eat or drink. And that was going to be the end of the Health Science Club. And part of it was because we weren't getting the teachers to help us, the professors to help us. Well, all the professors came and all the students came, and we filled the whole place up, and they picked up the tab for the pizza and beer, and then committed that we would get the club going again and that we would support it and so forth. And so we had a couple of events before I graduated, and it was but it was a lot of fun. And it was just a kind of a funny memory about how we kind of got the club to re-engage and so forth.
Great. Thank you for sharing those memories. It's fun to know, what others experienced throughout their educational career at their university. The next question is, being a first generation student, did you find it challenging to navigate the health education system?
my parents were very supportive of what I was doing. Neither of them had gone to college. My mom, I think, got her bachelor's the year after I did, or maybe this right around the same time. And so it was actually very, we worked on a lot of courses kind of along the same way. She was in a different path, but so that was probably really helpful as I think back on that. My father was not, he was probably one of the smartest men I ever met, but he was not formally educated. He was a voracious reader and read a lot. He was very knowledgeable, but he had never gone to college. I think he was very proud and very supportive of me going through that. It was something that was, kind of navigating your way through it. I had, and since then, since I've graduated, my older sister has now, I think she's got a bachelor's and a master's degree. And my brother has a bachelor's degree. And I mentioned my mom, she had earned a bachelor's degree as well. So yeah, it was good.
You set the bar high. Everyone started following you. So that's good. David, so you've made a huge impact in our community. Is there anything else you're hoping to accomplish personally or professionally?
Yeah. So, when I left the health department, it was a transition that I wanted to be very deliberate about. And I knew that it was time. I knew it was time to leave the director job at the health department. And I talked with the assistant director, David Lucchini, and Dr. Vora, and let them know what my plans were, and they helped me through that. But I wasn't looking for another job at that time. I knew that I was not ready to stop working, but I needed a transition. And so my wife, who was very supportive throughout the pandemic, said, just take 90 days and just don't even do anything. And that was the best advice I had gotten. I think it was on the 91st day, I got a call from one of the Board of Supervisor members, Steve Brandow. And he said, Rich Caglia is trying to track you down, and he's got some plan about doing something, and he wants to know if I can give you his number. Absolutely, give me his number. So Richard Caglia called me and said he was putting together a more comprehensive program for the 4 companies that Caglia Environmental operates. And they're all about recycling, waste management, landfill operations, which is kind of my roots. And so I was very interested and intrigued by the discussion. And so we talked, and I ended up hiring on with Caglia Environmental. And my goals are to build a more sustainable environmental health and safety program for them. And it's big challenges. It's dealing with, we have sort workers and line workers that, speak only Spanish. And we've got to make sure that we're delivering health and safety programs that meet their needs and that we're consistent with them. We're in one of the most heavily regulated industries in terms of environmental regulations as well as occupational health regulation. And so I want to put together a program that's sustainable and that they can be proud of. And it wasn't really by accident, I don't think, that I ended up choosing to go to work for Caglia. I had worked with them back in the 90s on their landfill application, their permit that was a new permit that was required for landfills that had to be issued by the state. I worked on that permit, got to know the family to an extent at that point in time, and have always been impressed with their not only their work in the community, but the philanthropic endeavors that they do and how much they give back. And I have been very pleased to be working with them, and I hope I can provide them a good product for the next generation of environmental health and safety professional going forward. And I will be hiring someone, so I'm going to be reaching out to Fresno State. I would love to bring on a professional position. Both myself and Janet Gardner, who are doing the work right now, are not in the beginnings of our careers, and we both are looking to be able to put something together that's sustainable and long-term. So I definitely will be reaching out to Fresno State for that.
Great. That'll be a great accomplishment, and I wish you the best with that new program.
And I would love to do some lecturing at Fresno State. So maybe I can get a couple courses in and talk about some of the topics, maybe help out some of the programs as we go forward.
Great. After being in the public health field for over 30 years, what advice do you have or could you offer to young public health workers or current students in the public health program?
Well, finish that education, get that degree, whatever it takes. If you're a nurse, get the BSN. If you're an environmental health specialist, get the registration. Make sure that, at whatever it takes to get that part done. And then, I think it's what I was able to do, and what helped me was be in a position to say yes. Be in a position to take on a new challenge and a new program that maybe other people don't want to take on. I remember, some of the programs that people didn't want to take on. One of them was tattoo and body piercing. The state comes down with new regulation dealing with tattooing and body piercing. Nobody really wanted to do it. Well, you know what? I stepped in and helped Fresno County get that program implemented. We took it in environmental health at the time, and it's become, it's a really good program to work with. So, and then with regard to becoming the director, that wasn't my career goal. It wasn't that I wanted to be the director of public health in Fresno County. I was actually quite happy being a division manager in environmental health. I thought I would end my career there. Then there's a change in leadership, there's a void, and the county administrative officer comes to me and says, "Can you fill in?" And and he says, "Think about it carefully, but can you fill in?" I was in a position to be able to say yes. And I think that's what I would want to, encourage students, is be in a position to say yes. And it doesn't mean that you have to have all the skills, that you have to have all the abilities. I relied a lot on relationships and peers and working together with people. That helped me overcome a lot of the gaps that I had with regard to technical knowledge and so forth. And so, just don't be intimidated, keep pushing forward. And then get out from behind the desk. If you get into a government job in particular, make sure that you're going out to the community. Make sure you're spending time. Fresno County is huge, 15 incorporated cities, all very different in the way that their culture, their backgrounds, their socioeconomic conditions and so forth. And you've got to be in a position where you can go out and see really what the human condition is, meet people where they're at. One of the most interesting meetings I was ever at was when we were working through the indigent healthcare program, and there was a particular group that was very passionate that we needed to do a better job at Fresno County to address the healthcare needs of undocumented individuals, and so she was smart. The lady who runs the program was smart in inviting me to one of their community meetings. So here's 6'2" white dude at a community meeting in South Fresno. No one speaks English. And I was supposed to explain our program. Now they had an interpreter there, but the reality changed for me when I left that meeting. My understanding, number one, they couldn't have been more kind. They couldn't have been more gracious. We thought it was going to be more contentious. But they were grateful. They wanted to hear what I had to say. They were respectful. They had great questions, and I learned a lot from them. And then the funny thing as I left the meeting, they had a special area for the children to play, and they had done some artwork. So the organizer says, "Okay, now you have to go in and you have to pick the best art." And I thought, oh my goodness, you put me through all this, and now I've got to go pick, which art is the best. But my point is that what that community organizer was doing, what she was trying to get me to do, was to connect and to see and to hear and spend time with people. And I learned that was very important. That helped me a lot as we went through, even through the pandemic. We had a lot of questions with regard to faith-based issues and so forth. We brought them all in and brought them all together. And I wasn't concerned. I wasn't afraid of that because I had been through it before. I knew that while there may be criticism, I would learn more. We would hear from them, and it would be a good voice to hear from them. So, advice to students, learn your community, learn your program, connect with people, make sure that you are getting out and working in the community.
Great. Thank you for sharing such wonderful advice. I feel like as a new graduate student, sometimes we're afraid, to apply to certain jobs because it says 3 years of experience,
Yeah.
even if you have a master's or a bachelor's, and, sometimes we're afraid to take that next step, but I really appreciate your advice.
Good.
With the College of Health and Human Services Top Dog Award, you're being recognized for your accomplishments as an experienced public health professional, as well as a community leader. What is your leadership philosophy?
I have always, the couple of different angles. One is to treat people with respect and make sure that they bring their life experiences to their job. I value when people, one of the most compelling disciplinary procedures I was involved with was a lady who is having a difficult time showing up to work at the right time. And it was a perpetual problem. It was really annoying the manager. And as we went through the disciplinary process, they would come to me. I would have to make the final determination if there was going to be discipline that was going to be imposed. And it turned out to be this wonderful dialogue between myself and this nurse about what her challenges were at home in getting to work on time, and really trying to find a way to make sure that she was successful. What was interesting is, as we went through the discussion, I asked her, why did you even choose to be in public health? And why did you choose to be a public health nurse? And she told me when I was young, she was pregnant and alone, and somebody knocked on the door, and it was a public health nurse. And she was inspired. So years later, she's sitting in front of me, and we're trying to work out getting to work on time. And I'm thinking, you need to be our champion for recruitment, and you're a perfect example of why we need to have you engaged in our programs and part of our program. So, treating people with respect and making sure that you know who they are and what they're about was very important to me, and really helped me. And then holding people to a high standard, and then letting them do their job, which as a manager of a large organization is sometimes hard to do, because I want them to do it the way I want it done. And what I realized at some point during my career is I really didn't care how it got done. What I wanted to be careful about was what got done. Did it get done the right way? And so when you empower managers to carry out things their own way and to use their own problem-solving skills, it's very rewarding as a manager to see that, and then to be able to see that happen. So that I did a lot of that, and then really empowering people. It was always frustrating when we had people who left the organization for the right reasons, right? It was hard, but it was also very rewarding when we had people that moved on to bigger and better positions, and that they could take a part of them with them. And I always knew that while they may be leaving the county, and I mentioned some names there before about people that went on to other director jobs and so forth, as a leader, it was very important for me to show the staff that worked for me that promotion and opportunities were there and existed. And rather than being fearful of that, we celebrated it. And then in terms of, as in local government, you have to be aware of local politics and local political leaders and local elected officials. And so part of, my leadership was making sure that I understood and did the best I could to make sure that I knew where those leaders wanted to get and to try to help them get there. We didn't always align on issues. But that really wasn't my job. My job was to make sure that when they wanted to get something done, that I did the best I could to carry that out. But understanding, particularly if you're in leadership in local government, understanding how local government works and understanding how local boards work is very important.
Wow, such a great leader. This is why you're receiving this award. And lastly, who is one person who has made a significant impact on your personal, professional, or educational development?
Well, I won't give you a one answer because I don't know that I can. I mean, I will tell you some people that have had a big impact on me. At Fresno State, it was probably Dr. Richard Haas. He was a human ecology and biology teacher. He's the one who got me really inspired to be passionate about science. And he's the one who helped guide me to environmental health. I had opportunities to see him in the community years later, and had a very special time to meet with him, coincidentally, not long before his passing. He was a remarkable professor, and I really enjoyed him. Early in my career, there was a gentleman by the name of Gary Carrozza, who was really my mentor early on. And I learned a lot from him. He became the director of the Department of Public Health. He was the director for a few years. I learned just a ton from him. And Ashley Swearingen, she was one who I worked with very early on. She's one of the most organized. She can run a meeting like no one else. I picked up a lot of skills from her. I worked with her on a couple of different commissions, and then she was obviously the mayor of Fresno for 2 terms, and then is part of the Fresno Community Foundation. I reached out to her during the pandemic to help carry out programs, but I used her a lot as a mentor over the years. And then 2 physicians that were very impactful to me, Dr. Ken Bird, who was the health officer for most of my time, was one of the most patient and understanding people that I could ever meet with or work with, but he was also one who had a hard line on public health, and he would not compromise, and he always kept me grounded and guided. And he was a very effective communicator. I learned just a ton from him, and we worked together very well. And then Dr. Race Vora, who's the current health officer. It's not by accident that he's the county health officer. He and I work together not only very well, but I have a tremendous amount of appreciation and respect for the work that he's done in our community. And while we were peers, he was truly a mentor for me in many ways, not only personally, but professionally as well.
Great. Thank you so much for sharing, your time with us today. I'll go ahead and hand it over to Dean Denise.
Thank you. Thank you, Dave. This has just been wonderful. I have a question though for you, because as I was listening to you talk about the pandemic, I know that I had to recover from the pandemic, and I didn't lead anything frontline or any such thing. So how long did it take you to recover, and or is it possible that were you able to recover? That is such a lofty task that you had.
I was surprised. Everybody deals with this differently. One of the things that was really pretty remarkable during the pandemic was my counterpart at the Department of Behavioral Health was Dewan Utek, and she was a very effective leader in our community. And I could count on her to call me about 6 o'clock at least one night a week and say, "How are you doing?" She would check in on me. How are you doing? And that was very helpful in terms of managing things as we went through it. But in terms of after there were 2 big points. One was making the decision to leave. I made that decision. That wasn't so hard. My wife had been great counsel to me on that. I think that she recognized that I absolutely needed to do this, and she was very supportive. Making the decision, it was harder when I disclosed it and made it known to the board and to my counterparts. That was hard for me. It was at a time when the case rate for COVID was way down. The vaccine program had been rolled out. I felt we had a few months of relief. We didn't know about the Delta variant at the time. It was at a good, and we had survived the Creek Fire. So I felt like it was a good time. I would say it was probably 30 to 45 days. And I thought I felt like I was, it was a week, but it wasn't. It was, it took a good 30 to 45 days to really kind of be done and know and not have that anxiety that you feel continuously with regard to having that responsibility.
Well, I admire what you did, and you let us, like, because I had listened to some NPR stories about people in positions like yours and their whole world. In some places, you mentioned this idea about the state setting some rules, and I think in this political environment, that was a game changer in California. That in some states that was not the case, and it was each to their own, right? Each health department director, and that there were some definitely very challenging circumstances out there that folks were having to deal with. And I listened to these stories and I just thought, oh my goodness, no health educator, public health person ever imagined that being their life ever. And so, yeah, I just really admire the role that you took and the grace in which you did that.
Well, thank you. I know that there were some times where it was hard when we knew that there were parts of the community that were very frustrated. Mm-hmm. And they would come down to the health department and they would picket in front of the health department. And I always would put out a message to our employees and say, this isn't about you. This is about frustration. You've shown up every day. You've protected the community. You've been on the front lines. You've been the one masking up. You've been the one that took the risk. And just have to remind them that they don't know, it's misplaced frustration. It's not about the Fresno County Department of Public Health and its employees, but you have the sign on the door. And so that's where they show up. But just having to continually remind people that was it. And frankly, there were a lot of people who just did the right thing. There were a lot of businesses in our community that just did the right thing. And I'm not saying that, just absolutely following every rule was the right thing, but they were protective of their employees and they took it seriously and they implemented the control measures and they used the best practices and they adjusted them over time. And that's really what we were asking to be done. We wanted to maintain, credibility with our local folks as much as we could. And, I'm really glad that we were able to do that.
Well, thank you. So we do have a few questions from our guests. Richard asks, what are you currently working on? And we have already talked about that, but what do you like about what you're currently doing?
So a couple of things. One is that Kegley Environmental has a very strong philosophy about safety and environmental protection. And what they need is really kind of an organizer who can pull all of that, the great momentum that they have together and make sure that it's a well-documented and sustainable program. And so right now I'm working on, pulling all those pieces together. I love some of the training, the interaction I'm having with employees in just doing basic things like training. And sometimes it means getting up at 5 o'clock in the morning to go meet our drivers who start their day at 5 a.m. And they're happy, they're energetic, they're pleased that I'm there. That's very rewarding. They want to learn, they want to understand, they want to be safe. So some of those projects are very exciting. There's a couple of technology initiatives that we're embarking on to do a better job of not only tracking all of our health and safety programs, but really empowering our employees to be able to identify, if they identify a workplace hazard, they identify a concern, that can quickly be recorded and that can be processed and that we can get to work on it. And the company has been, this is where they want to go. It's what they're about. And, I feel very grateful that I'm able to do it, but it's a big challenge. So it's another new challenge for me.
It's fun. It's nice that at different stages in our life, we're ready for different challenges, right?
Yeah, absolutely.
So Melissa asks, you mentioned how much you value your relationship with Fresno State students in the Department of Public Health. Can you talk about why it's so important for you to now give back to the university and upcoming professionals in the field, particularly with internships and mentoring?
A couple of things. One is, I don't know that I would have gotten a degree had it not been Fresno State. I mean, it was, and a lot of what happened while I was at the university. But I think more importantly, it was when I needed the university, when I needed help, they were there. Mm-hmm. And that was very, very meaningful to me. And it was setting up the lab. That was a big deal. But it was also, we needed help with testing and vaccinations, and we needed your population. We needed you to be able to address your population effectively because we didn't have the bandwidth to cover it all. And so we have had and continue to have a great relationship with the clinic at Fresno State and with the programs that with safety and security and so forth. So we had gone through I think it was a mumps outbreak within the year prior. And I think we had a TB situation as well at Fresno State that, our teams worked together very well. But during the pandemic, it was Fresno State, that was a solid resource for us to use. And then, of course, when they got into, coming back to the university, they, we helped, but they really took the initiative to set up the testing programs. We helped with vaccines. We got vaccines to Fresno State early on when we were allocating it, and they did a very effective job at giving back or making sure that the vaccine program got implemented. So, my desire to give back is really based on that, and I would love to be able to share as much as I can.
Thank you. And so for our last question, Dr. Zagrafos, being the great mentor and department chair that she is, says, many of our students end up working at Fresno County after graduation. Can you share any advice on how they can make their application and or interviews stand out from the rest? And we hope, we know Dawn and Lupe will be welcoming your wisdom.
Yeah, I think that, part of the internship, it makes a big difference if the student that shows up takes it very seriously. And I'm not saying they have to be serious all the time. I'm just saying they have to take it seriously. They have to treat it like they are interviewing for a job from when they walk in the building to when they go home at night, and take as much as they can from that, even if it's small pieces. Because as a hiring manager, I want to learn about, what you've done. And it may not be that you've done years and years worth of work on something, but if you can show me a couple of things that you were able to do. And so really encourage, if you're in an internship program, if there's opportunity to do things independently, if it's helping on a research project, or maybe it's if you're conducting an inspection at a restaurant, ask the inspector, can I do the documentation? Can I talk to the owner? You can stand right next to me, but can I do that? Then when you're going through your interview process, you can confidently say, I've done that. I've spent time talking to an owner about the results of an inspection. So take as much as they can from that internship experience to allow them to set themselves apart. The other thing that that candidates and applicants always miss is, I will say, what's your experience been in public health? And they'll say, well, I don't have any. This is my first job, my first job in public health. And I'll look at their resume and they go, well, they worked at In-N-Out Burger for 4 years, right? Well, that's not public health. Well, no, did you show up on time to work? Were you prepared? Did you follow the policies and procedures of the company? Did you do all those things? And then what health and safety procedures did you implement? And I don't care if you're working at a tire shop or anywhere else, you should be using those real life experiences to make that connection. Oftentimes I have to mine through a resume to drag out the experiences. If you don't have to do that as the person, if you're on an interview, you need to put that out there. You need to say, I may not have a lot of experience in working for you, but here's the experience that I do have. And I can show you. And I don't care what the job is, you can relate it to public health.
Yeah, great. That's great advice. And it ties back. Last week, we had our president's lecture on grit. And she was talking exactly what you just said, that you worked at In-N-Out Burger for 4 years. And she talked about hiring people who had held a job for multiple years. It doesn't matter what job, but that alone shows the grit that people have in their ability to stay committed and hold down commitments to long-term things, and that puts them in good light for employers. So thank you for reinforcing that message. I feel really fortunate to have been here with you tonight, and thank you for giving us the privilege to get a little bit of insight into your wisdom. One of the things that you said tonight that really stuck with me was be in a position to say yes. And I think that's great advice for all of us, no matter what stage we're in. And it doesn't mean say yes to everything.
Right.
It means say yes to the right things that are going to help you with whatever you achieve your goals or move forward or open a door, whatever that is. And I really, really, really appreciate that. And then your advice about learning your community and getting out and connecting with people. And I think it's important to public health, but it's important to all of health and human services that we connect with our community, that we know our people, and that we become part of that. So thank you for those messages. Thank you for giving us a little insight into 30 years as a health professional. Well, much more than that, but the 30 years at the health department is pretty amazing. And I feel really, my life has been enriched from this conversation and some definite takeaways. So thank you, David. And I have the privilege of getting to celebrate a little bit more with you later this week. And I'm grateful for that. But thank you for sharing your time and wisdom and expertise with us tonight. So please join me in congratulating David on being our top dog. You can put it in the chat. You can open it up, your sound, and give him a whoop whoop, whatever is your style. But thank you so much for a wonderful evening. And I wouldn't be remiss without saying to Lupe and Dawn, thank you for bringing exceptional professionalism and just great pizzazz in your interviewing. That was very well done. And you set a great example for many students who are to come. I have to shout out to my team, Beth and Amy and Michelle and Melissa, in making sure that we have everything in order tonight. And so thank you all for helping us put together a great evening of learning and wisdom. And David, shout outs to you. I hope you're reading the chat as people are giving you many shout outs, and we're just really grateful for that you're one of us. So thank you.
Thank you so much. This was the highlight of my week, of the whole process. Thank you.
Outstanding. Well, thank you all and have a wonderful evening.